the artery with the plaque is right here starts to cinch in. So you might be like 10 a.m., woke up feeling dizzy. We have another procedure, need to go quick, so I'll see you guys later. Good morning everyone, welcome back to this week's vlog. I'm in a rush to get ready right now because it is 6 a.m. and if you watched last week's vlogs, you know I'm shadowing a cardiologist today. So I'm super excited. I haven't got to shadow cardiology and it's definitely a field I'm considering, so really excited about that. I know the schooling for it is really long. I mean, it's usually around like 3 years of internal medicine residency and then additional 3 to 5 years of cardiology training specifically, depending on what type of cardiology you might want to go into. So I know it's a lot of schooling, but it's definitely something I'm very interested in. So I wanted to shadow and honestly take you guys with me so you get to see as well. I know the cardiologist I'm shadowing does procedures and then also just regular cardiology, non-procedural work. So hopefully you get to see a bit of both. And yeah, so let's go ahead and do that. Alright guys, here is the outfit of the day. I have some just white jeans and a casual, business casual top. And just in case I get cold, I'm just bringing like a little blazer with me because I know the hospital can get quite cold sometimes. And thankfully the hospital already provides scrubs if we have a surgery or something, so I don't need to separately bring them and I can just use the ones that are at the hospital. So yeah, let's go. Change into scrubs, going to go watch a procedure now, let's go. Procedure is finished. They replaced the battery for a pacemaker. We have another procedure, need to go quick, so I'll see you guys later. We had a patient whose arteries were literally completely, one of them was completely blocked, and so we had to do a catheterization to get that out. I'll let you guys know more about that later. Alright guys, so today cardiology shadowing was an absolute success. I absolutely loved it. It was an interventional cardiology and so much happened. So let me just break it down for you guys. So in the morning we immediately started with a procedure, and this procedure was replacing the battery for a pacemaker. So a fun fact is that pacemaker batteries typically survive for around 10 years on end, especially for patients that are constantly using the battery on a day-to-day basis and extensively. Like for example, if their heart needs the pacemaker to even pump or survive. And the whole process was super intricate and cool. They first make a little laceration, usually around above chest level where the pacemaker actually is. And then once they make that incision, they're making sure to cut all the way to the battery, but careful not to cut the leads that are actually connected to the heart and the battery, because those need to stay. We're only replacing the battery itself, or sometimes it's called the generator. And so the physician's making those small incisions until they reach the battery, they unplug the battery, put a new battery, reconnect the leads back, and that's really it. And then after that, they make sure to flush the area with antibiotics, and they also added an antibiotic like patch or tablet inside to make sure that no infection could occur. So they really take all those precautionary measures, and it was just so cool to see like actually in person and up front. And then aside from that, the rest of the morning was filled with just looking at stress tests, EKGs, and ultrasounds. And a fun fact was that if like in the ultrasound, if you see areas that look shiny or maybe even thick, that's usually calcification. And then another thing I got to see was a bubble study, which I've never seen, which is pretty cool. And usually this procedure, what it does is bubbles are kind of injected into the veins of the heart to kind of see if they travel from the right side of the heart to the left side of the heart. And this helps to see if there's any holes in the heart or leakages that can be abnormal and cause harm to the patient. And something super cool that I honestly didn't expect to see or even knew existed was that a lot of times patients that have high blood pressure and leave it untreated, meaning they don't take their blood pressure medications or make sure to follow strategies to reduce their blood pressure, a lot of their arteries in their heart, instead of looking kind of like a straight looping line, can start to spiral up and look coiled shape, which is not really necessarily good for the heart, but that can start to appear with untreated blood pressure. And then looking at EKGs versus stress tests, EKGs are much more chill in the sense that patients can really just sit down and lie down and then have the leads connected to them. Whereas stress tests, patients are constantly doing activity, whether it's running or walking, that kind of puts stress on the heart, and then the heart activity is seen in intervals to see how well the patient's heart is pumping. And then later in the afternoon, oh my gosh guys, this was the probably most chaotic procedure that was going on. There was a patient, she was about to have a heart attack, and actually her main artery was completely blocked. And basically what happens is plaque builds outside of your arteries, and then as it builds up, the artery with the plaque is right here starts to cinch in and causes like blockage or very minimal blood flow between the arteries. And in even worse cases, sometimes the plaque buildup can pierce through the artery and cause like holes, and then what happens is your blood cells are fighting to patch up that hole, and what happens is it actually turns into a blood clot, which doesn't allow any blood flow through your artery. And we had to immediately do a catheterization on her, where they inserted a balloon catheter into the artery to hopefully allow more blood flow to flow through her heart. And then honestly, the rest of the afternoon, we just finished any of the stress tests and charting, whatever the physician needed to do that day. And honestly, the day was so cool. I'm so excited to be back tomorrow. Tomorrow's my last day shadowing in cardiology. So stay tuned for tomorrow. I'm super excited to let you guys know what happens then. Morning guys, it's 7 a.m. right now. I've already gotten changed. Here's the outfit of today. It's 7 a.m. so I need to run and eat breakfast because I need to be at the office at 8 a.m. So yeah, let's go. Some soup and asparagus for lunch. Alright guys, so shadowing is completed today. So today was a lot different than yesterday because yesterday we did some procedures, whereas today it wasn't really any procedures. So in the morning it was focused a lot on patient follow-up. So a lot of the patients had procedures done the night before, whether it was hip replacement or foot surgery, ankle surgery. And so then the interventional cardiologist I was shadowing went to go check in on them and make sure that, you know, their heart was doing well. And then after we rounded with the patients and made sure everyone was stabilized and doing good, we went ahead and looked at any stress tests that we hadn't reviewed from the previous day. So let's talk a little bit about what I learned from that. So first we have atrial fibrillation. So atrial fibrillation is just when the heart beats irregularly, and on an EKG you can see this as like disorganized patterns on the screen. So in this picture you can kind of see what atrial fibrillation looks like. But then we have atrial flutter, which is very similar. It's like a brother of AFib, but it's more organized, if you will. So you see these kind of sawtooth waves, which I saw for the first time ever, and in this picture you can kind of see what that looks like and how that differs from atrial fibrillation, but also how it might look kind of similar. Then we obviously have tachycardia and bradycardia. So tachycardia means that your heartbeat is very fast, and then bradycardia means that it's quite slower. And for reference, your average heart rate should be around 60 beats per minute to 100 beats per minute. So anything like around 60 or below is considered bradycardia, and anything above 100 is considered tachycardia. But it's important to keep in mind that, you know, for example, when patients are sleeping, these things might fluctuate and they might have signs of bradycardia or tachycardia depending on sleep patterns and what stage of sleep they're in. So don't always like focus on just this when they're sleeping to decide if they actually have these symptoms. And also sometimes on EKGs you might see these little hash marks. Those little hash marks are usually caused by pacemakers firing. Kind of that visual cue for cardiologists to know that it was a pacemaker that was actually used to maintain the heart's rhythm. And then another test that we got to see was a tilt table test, which I'd never really seen before. It's mainly done for patients who experience a lot of dizziness or fainting, and you essentially basically have them lie flat like on a table, and then you'll quickly tilt them upright to see if there's a change, like if their blood pressure drops or if they pass out, for example, which you don't want. But you basically tilt the table, you know, quickly at different angles. And then we also looked at Holter monitors. So if you've worked as a medical assistant like me, you probably have heard of this and kind of know what it is. It's basically a little device that's like almost this big, and you either wear it on a strap around your neck, shoulders, or waist, and you technically wear it for up to 24 to 48 hours. And then you have this diary that you just write down, you know, what you did each day, like when you woke up, when you went to bed, and anything that makes you feel fatigued or any symptoms you're facing. So you might be like 10 a.m., woke up feeling dizzy. And when you're wearing the Holter Holter monitor. You can literally do anything, do your daily activities, just resume as normal. The only thing is you just can't get it wet. And then as the patient is keeping a diary and keeping track of, you know, what they're doing and how they're feeling, the Holter monitor is taking their heart rhythms. When the doctor's reading their notes and their EKGs, they're able to see exactly the timestamp of when the patient said they're feeling dizzy, and then able to see their corresponding EKG to see if there's any problems with the heart's normal rhythm. And then if anything abnormal is there, the next step is usually just to get a stress test and continue care going forward in that direction. But yeah, these were some of the things that I learned, and honestly, it was an incredible experience. If you can go shadow a cardiologist, definitely go do it. I literally learned so much within these 2 days, and I'm really excited that I got to share this with you guys and hopefully get you guys some of that information. If, you know, it was helpful, make sure to like the video and subscribe, because I'm gonna be doing a lot more videos like this. And I know when I was in your shoes, having this information would have been really helpful. So that's what I strive to do with this channel, just provide you guys with the information that, you know, could help you guys on this journey and just make it a tad bit easier. But anyways, I'll see you guys in the next video. Bye.